All right, welcome back to The Explainer. Today we're tackling something pretty much all of us have dealt with at some point, bronchitis. So let's dive right in. Oh, you know the one I'm talking about. It usually shows up right after a cold, and then it just hangs on for what feels like an eternity. That nagging, hacking cough is, without a doubt, the classic calling card of bronchitis. So what is actually going on inside our bodies when we have that awful cough? Well, it all boils down to one simple yet really powerful process: inflammation. Okay, so think of it like this. Your lungs have these branching tubes called bronchi. They're basically the superhighways that air uses to get in and out. Now, when you get bronchitis, the lining of those highways gets all inflamed, swollen, and gunked up with mucus. And that roadwork analogy is perfect, right? It narrows the lanes, makes it way harder for air to pass through, and that's what triggers that relentless cough. But here's the thing. Bronchitis isn't just one single thing. To really get what's going on, especially the kind that most of us get, we need to zoom in and get a little more specific.
And wow, it's actually kind of surprising how many different ways doctors can classify this illness. I mean, they look at how long it lasts. Is it acute or chronic? They check out where it is. Is it in the big airways or the tiny little ones? They even classify it by the type of inflammation. It's a much more complex picture than you might think.
But here's the key, the thing you really need to know. Despite all those different classifications, the overwhelming majority of cases, the kind you and I get, fall into just one category: acute infectious bronchitis. And that's exactly what we're going to focus on.
So let's just unpack that for a second. Acute just means it's a short-term thing. Diffuse means the inflammation is all spread out. And the most important part, it only affects the lining of the airways, not the deeper lung tissue. And that last part, that's super important. We're going to circle back to that for sure.
You know, you can almost think of every case of acute bronchitis like it's telling a story. It's got a beginning, a middle, and an end. So let's trace that journey, starting with what causes it in the first place. So, who's the bad guy in this story? Well, almost every single time, the first invaders are viruses. Yep, the same ones that give you a common cold. They're the ones who kick off the inflammation, the swelling, and all that mucus. Bacteria, on the other hand, they're usually just opportunists. They might jump in later when your immune system is already busy, and that's when you might see the mucus change from clear to something, well, a bit thicker and more colorful. And of course, there are things that can make you more likely to get it. Cold, damp weather can put stress on your system. Working in dusty places, or the big one, smoking. That directly irritates your airways. Heck, even just having a stuffy nose that makes you breathe through your mouth can raise the risk, because your nose is your body's #1 air filter. And this is what that story usually looks like, day by day. It all starts with a virus latching on. A couple of days later, that annoying, dry, hacking cough kicks in, and you just feel kind of blah. Then the cough changes. It becomes productive, which is just a nice way of saying you start coughing up gunk as your body clears everything out. And then, thankfully, this story usually ends with a full recovery in about 10 to 12 days. Okay, so we've got the story of the illness down, but how did doctors actually figure out what's going on? And what's the most important thing to take away from all this? And you might think it's just a cough, right? But telling the difference between bronchitis and something way more serious, like pneumonia, that is absolutely critical. So how do they nail it down? It's really a bit of detective work. First up, a doctor's going to listen to your chest for any harsh breathing or rattling sounds. They might check out a mucus sample to confirm there's an infection. And blood tests can give some great clues too. A low white blood cell count often points to a virus, while a high count might suggest bacteria have joined the party. But the most definitive test is all about what you don't see. And this, right here, is what separates bronchitis from a more serious lung infection.
And here it is. This is the sentence that makes all the difference. When a doctor gets a chest x-ray back, and it's clear, no signs of inflammation deep in the lung tissue, that's the confirmation. It tells them the problem is just in the airways. It's bronchitis, not pneumonia.
So, when you boil it all down, the big takeaway here is this: acute bronchitis, as miserable as it can be, is usually a short-term thing. Your body's immune system is pretty amazing, and it almost always wins this fight all on its own in about 10 to 12 days.
So what can we really learn from this super common illness? Well, it's a powerful yearly reminder of just how vulnerable but also how resilient our respiratory system really is. It shows how easily tiny invaders in our environment can mess with our airways, but it also shows how incredibly good our bodies are at fighting back and healing.
You could almost call it a recurring stress test that reminds us why taking care of our respiratory health every single day really matters.